each other will carry us through. We are here, with our neighbors. Our love for each other will carry us through. We are here, with our families. Our love for each other will carry us through. We are here, with our city. Our love for each other will carry us through. We are here, with our voices. Our love for each other will carry us through. We are here, with our voices. Love for each other will carry us through. We are here, love for each other will carry us through. We are here, with our story. Our love for each other will carry us through. We are here, courage. Our love for each other will carry us through. We are here, courage. Our love for each other will carry us through. Yes, our love for each other will carry us through. One last time. Yes, our love for each other will carry us through. Here, Serena Partridge, I'm singing
Good evening, friends. I'd like to take a moment to welcome everyone into this. Take a deep breath. Feel your feet on the floor. Settle into your seat and notice where you are and how you're feeling. Right now, in this moment, today, everything you bring with you today and all of us gathered here today are welcome.
Welcome, people of Latino descent, First Nations, and Indigenous descent, African descent, Middle Eastern descent, Asian descent, Pacific Islander descent, European descent, and people of mixed, multiple descents. Welcome, women, men, transgender, and non-binary people. Welcome the many feelings you have about climate change, nervousness, your hope, your despair, terror, feeling of powerlessness, and the part of you that feels connected with others and feels powerful.
Welcome languages spoken here: Spanish, English, Chinese, American Sign Language. Welcome provinces and countries represented. Welcome those who identify as having a disability, visible or invisible. Welcome heterosexual, gay, lesbian, bisexual, queer identities. Welcome migrants. Welcome people who have been in gatherings like this and those who haven't. Welcome the many ways people in this room have gained knowledge, those who have acquired it formally or informally.
Welcome those in their teens, 20s, 30s, 40s, 50s, 60s, 70s, 80s, 90s. Welcome people of different religious faiths, Jews, Buddhist, Muslims, Christians, Hindu, traditional religions, Baha'i, atheist, agnostic, or others. Whether searching, given up, or other faith tradition, welcome those who want you to be here, those who make it possible. Welcome family, genetic and otherwise. Welcome those dear to us who have died. Welcome our elders, those here in this room, in our lives, and those who have passed away. Welcome everyone, whoever you are, wherever you come from, you are welcome here. Before we get going, I just want to orient us to the space so that you all know where everything is and hopefully makes this evening more enjoyable for you to participate in. So a lot of it is going to go through this magical hallway to my left. You will have a single occupant bathroom on through the hallway. There are two more downstairs, one with a urinal and a stall, and one with two stalls. Childcare is in the room behind the sanctuary, again, through the magical hallway. If you need a quiet space to ground yourself or for whatever purpose, it's called the large classroom, once again, through the left. Art is still happening downstairs, so if you desire to make more, please go downstairs. And welcome, and I hope you have a fun evening learning and doing, and have a great time.
Hi everyone. My name is Caleb, and I'm a part of Common Pulse Vocal Ensemble. We're a community of musicians here in Chicago who, among other things, invite our neighbors to make music rooted in resistance movements past and present. There will be music throughout our time together, led by Common Pulse and Songs for Liberation, and you're warmly invited to participate in whatever ways feel good to you. And if this kind of music making feels good or intriguing to you, there will be more opportunities to sing together like this in July and August here in Chicago in gatherings called Community Pools. And I hope you'll join us. And you can learn more about that by talking to any of the singers or checking out our Instagram, which is @CommonPulse.
Hello, everyone. My name is Emma. I use pronouns like she and they. I am a member leader of the People's Lobby, which is the organization which put a lot of this here event together. So I'm so glad that you're here with us today. A few other pieces of this. One, if you're like me and like to fidget, there are rocks to fidget with in the back, which honestly is going great for me. So you can grab one from the usher up there. You're welcome to do that. The People's Lobby is a grassroots political power building organization that is based largely in Chicago, but works across the state of Illinois. It also works with partners across the country in an organization called People's Action, and then further out with partners around the whole world. Our mission is to create a world which serves us, people and planet, not corporations and the profits of extremely wealthy people. And so the group of people that put this event together works primarily on making universal healthcare for all a reality for everyone in this room, everyone in Illinois, and eventually everyone around the country and the whole world. That's Kate, the founder of the Healthcare Task Force. She'll be back up here in a little bit, and I will hand it off to Sheree to finish up our introduction.
Thank you. So just one quick outline of the event. There will be story sharing, broad political education, and tying our current campaign to get corporate greed out of our public good. Medicaid as we build toward universal health care for all. Then there'll be time to talk with each other, move about the space, and create art together. And to hear from comrade legislators, Senator Guzman, Representative LaPointe, and Representative Guzzardi. Now we will have our first speaker, Kate Lujan Redling. She uses pronouns like she and her and is the founder of the Healthcare Task Force and the board chair of the People's Lobby. Please welcome Kate.
Okay. Good evening. Good evening. There we go. Thank you. I need that energy. Thank you for the introduction. And I want to say thank you to everybody that put this tonight together, and especially for the welcome that happened. I wonder, who heard something out of the ordinary that made them feel more welcome in those descriptions? That's beautiful to see all those hands up, and especially in a house of worship. I really, really appreciate that and want to shout that out. It's actually modeling the openness and community building that it is going to take to win everything that we're here to win. That is going to be the way that we actually find each other, is by being open about who we are and what we need, because we all need the same things. Okay, so I'm here today to tell a story of how we got to where the current health insurance system is, which makes billions for already wealthy people and actually makes us sicker at the same time. Is that right? That ain't right. After me, we're going to hear from my co-speakers first about how specifically to build the world that we deserve from Dr. Peter Gann, and then from Reverend Dr. L. Dowd, my comrade in handcuffs. Will share their story and cast a vision of the world as it should be, the world that it can be, and the world that we can all imagine together. Okay, so friends, we should go back. Back. Oh, okay. Yes. Yep. Okay. So just to set the table, where we are is bad. Sorry. Spoiler alert. Right now, corporations and billionaires actually make the laws and decisions which harm and kill us and our family members and our communities. Is that right? That ain't right. We're surrounded with resources. Literally right now, we put something together with the food and the drink and the community and the art and the love that we all need, the resources that we need. We've got Cook County downstairs helping people determine their redetermination dates. We've got all kinds of food pantry and community groups, and bracelet making is my favorite. Please make a bracelet. So we have what we need and we're surrounded with it. But we are barred from accessing them by people who currently have authority. Those are the same people who were supposed to help us, and it's hard to feel through the scarcity and lies and to have hope for a vision, but we can't do that together. And so while the place that we currently are is painful emotionally, spiritually, physically, in many cases, we're here today because we all believe that we can find that way together. So now, real quick table setting. We're gonna pop this up here. You could just boop, 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 okay? Normally we do a whole training about authoritarian playbook and the pillars of authoritarianism, and like we all go through this exercise of whatnot. I'm just gonna make this quick because I think we know where we are. Just raise your hand if you have knowledge about investigations against critics that are initiated by the federal government, license to law breaking, yeah. Regulatory retaliation against people using regulatory agencies, deploying ICE to our streets and airports, law enforcement overreach, and then someone who says they won't leave the White House. Okay, that's authoritarianism, all those things. For many people, and some in this room, we have known and lived in this space for much longer than Donald Trump. So let's recognize that and also lean into the fact that that means that we know how to defeat it because we have won many things. The Voting Rights Act. We have won many things, the Americans with Disabilities Act, by fighting, demanding, shutting shit down. Okay, so check. And this is not incidental. Keeping workers economically precarious is a feature of authoritarian rule, and it's not a bug. So now go to Alice Walker. Sorry, I must have jacked up these slides a little bit, sorry. So Alice tells us the most common way that we give up our power is by thinking we don't have any. That's why we're here today, to talk about this and set this table. Okay, so now let's go to the good news. So the authoritarian regime and the pillars. We're gonna show a picture that helps us imagine what authoritarianism is, how it functions, and what we're gonna do about it. So this is, for anyone with visual impairment, we are looking at a slide that has pillars like the front of the Supreme Court. On top is the authoritarian regime, and it's being held up by civil service, security forces, education, media, faith, corporations. These are all the pillars that are holding up. And there's lots and lots of people who are part of these pillars, okay? If you were to look at a cross-section of a pillar, you might see in the center, in the case of the corporate or business pillar, and there's lots of different pillars you can look at, right? These are the ones we chose. You're gonna see at the core, most protected in the middle is the CEO, the president, the head, the richest, likely. And then outside of that, there's some managers, then there's like some workers, then there's some consumers, and then there's everybody else. So the good news is once we know how something is built, we know how to take it apart. Once we know how the pieces come together, we know how to remove them. So a couple of highlights on some of these other pillars. For example, education is a pillar that when education systems are used to reinforce authoritarian beliefs and practices, like teaching false history, that doesn't include events that are real, like Martin Luther King and the things he actually did, and the civil rights movement, about Jim Crow, about the violence of enslavement of Black people that is tied to racial wealth inequity, inequality today. That would be part of the education, and it would look similar on the inside with just different names or different terminology. The media pillar really includes a lot of stuff, not just social media, not just mainstream media, but movies, news, newspapers, magazines. There's a lot of stuff out there, y'all, that people use for information. All of that is part of that pillar. Some of it is legit, a lot of it is not. We have to be looking at and dissecting these things to figure out what the pieces are and how they fit together, so we can identify how to pull them apart. So the other pillar that we like to focus on at the People's Lobby is civil service. That would include like the judiciary branch, the legislative branches, and things like municipal services and state government and all of the civics kind of stuff. This is a model, okay? It is not perfect, but it is a model that we can work with to help us shape the strategy for bringing this all down. So we don't need the other good news. There's a lot of good news, y'all. The other good news is we don't have to take down all of every pillar or even all of any pillar. We can pull apart, imagine Jenga, we can pull out enough blocks to bring this down without having to take out every block. Say that. Okay. So in the back to the civics pillar, we're going to come back to that in the healthcare system, shall we? We're going to do that with the corporate or business pillar. How have healthcare corporations used the corporate pillar to enrich themselves? Well, how haven't they, frankly? So initially, there was a privatization of our healthcare system. This is super, super simplified, and I would love to have a book club with you and talk about this for days. But we'll super simplify it for time purposes right now. Initial privatization of a public good. We need a company to run this like a business. Yeah. Then there's consolidation. A business wants an economy of scale. It just makes sense for a health insurance business to also own the pharmacy and have doctors. Then there's vertical integration. We really want to provide the full spectrum of goods to our clients, to our customers. We are patients, we are people with needs in healthcare. Then there's private equity. Well, I see a way that we can actually sell off all of these parts and make even more money off of it. Boo. Boo, yeah. And so in effect, the health insurance companies are really, at this point, unregulated banks. They are taking our tax dollars, they're taking money out of our paychecks, and they're holding us hostage. And they're holding providers hostage too in many ways. All right, how are we gonna fix it? Okay, first we find each other, check, here we are, look around. We did that, first step done. Those of us who have been denied care, has anybody ever been denied health care? Delayed your own care because of all the reasons? Not the least of which is precariousness and not knowing like where to start or feeling really overwhelmed. And all of this puts money in the pockets of wealthy people and corporations. Those of us who are outside of the pillars, those being hurt by the structures, are receiving no benefit, and in fact being harmed. So we do that, we find each other, then we identify who has the lever to make the change that we want. Many times it's legislators, and they're backed by powerful bases of people, that's us, demanding the changes that we need, or else. Legislators who can move policies and take money and power away from greedy insurance companies and put resources back into healthcare and the well-being of our communities. That should be the actual civics pillar. So after we identify who, then we identify how. How do we do that? How do we engage with the pillar of civics and the people that have the access to the levers that make the changes that we want? Well, we make it uncomfortable for them. We make sure that they're fighting for us. We use face-to-face meetings with legislators in Springfield, in their offices in our neighborhoods, in the grocery store, in the restaurant, on the sidewalk, in the parking lot, wherever it needs to be. We show up en masse at the Capitol, in Springfield, and at City Hall, and in their offices where we live. We raise tension in public through direct action, civil disobedience, and protests that target corporations and legislators if necessary. We change the public narrative so that it looks bad to vote against the thing that we want. The thing that we got together in community and figured out was the thing that everybody needed. Maybe we started out with the thing and we talked to everybody in here and we found out actually the thing needs to be a little bit more. It needs to be a little bit different. And then all of us want to show up at the meeting to make sure that all of the pieces get done. So I think this is slide 10, I'm not sure. The authoritarian regime is not invincible. Great, perfect. Thank you, David Wells, for this art. We might think of the authoritarian regime as being a pyramid, right? Where there is like the many people, the little people in the base, and then there's this king at the top. But the truth is, it's actually the other way around. And it's very precarious. We are holding up all of these pieces that are keeping this from toppling over. We are keeping these people in power by doing what's expected of us, not talking to each other and finding out what's possible and finding out that you actually need the same thing that I need, that I don't need to feel shame because I'm not alone. That's kicking these pieces out. So that's also good news. So much good news, y'all. All right. So then there is, I want to go back to, yep, I need to go, no, go, sorry, back the other way. Boopity boop, yep, that one, okay. All right, so quick overview here. Authoritarianism and economic insecurity is a loop. We talked about the authoritarian regime, and then we also talked about the fact that it keeps us doing a thing. Those things propping up the pyramid. We're doing that, we're holding that up. So economic insecurity breeds fear. Fear makes people desperate. Desperate people are easier to control. If I'm afraid to change jobs, or I'm afraid to speak up because I might lose my job, or I'm afraid to leave a relationship that is unhealthy for me because I may not have health care, that is fear controlling my decisions. Authoritarians weaken the institutions that protect workers' economic power, which creates more economic insecurity. They bust unions. They scare people. They threaten even faith organizations that organize people like this, where people can find each other. The insecurity keeps people fragmented, exhausted, and focused on survival rather than the political resistance. If we are all too busy working 5 jobs, we would never have time to come here on a Friday and share food and song and make bracelets. And that is sad. I don't want to live in that world. So this is not incidental. Keeping workers economically precarious, keeping us on edge and scared is a feature of the authoritarian rule. I don't think I'll ever say that without having to try really hard. Okay, and then the other slide. Thank you. Yes, economic security that we're experiencing because of what the authoritarian regime, does is not our failure. It is designed. So if I can't afford to lose my job and not healthcare, it keeps me from forming a union. When I'm working 2 jobs to pay for my health insurance and my bills, I don't have time to vote or go to meetings or organize. And when you don't have a union, you don't have the institutional protections. Imagine what our unions could do if they did not also have to organize and demand healthcare. Imagine how much more we could demand. Okay, so now we're going to have a music break, and then after that, you're going to hear from Dr. Peter Gann about what we're actually going to do. Thanks, everybody.
Oh, I'm so glad that I came after this because it fits so well. I wrote this, so I'm Judy from Songs for Liberation, and I invite Common Pulse to join me with this song. You can. You'll catch on. And I wrote this to inspire people to take part in hands-off protests like last April, a year ago, and they're not keeping their hands off the administration. No, it's not happening. So it still seems to be relevant. So I selected just one of the verses. And what I'm going to do is, if you want, you can stand up and sing along. And there are some hand movements. And when you say hands off, you go like this. That's good. And then the other, you can make up the other hand movements. This is a keytar. People always want to know what it is. It's called a keytar. And I'm using it in an untraditional manner, but it seems to work okay as long as I have this glass holder holding it. Okay, so I'll teach you the words to start, and then I'll add some music. Okay, so it goes hands off, hands off, hands off, hands off, hands off our Constitution, hands off our Constitution, hands off our parks and trees, hands off our parks and trees. We the people, we say hands off, we the people, we say hands off our rights and liberties, our rights and liberties. Oh. Hands up. I'm gonna say it, and then you're gonna repeat. We'll do that once, and then we'll sing it together, the chorus, and then I'll say the verse, and you'll come after me, and then we'll do the chorus again together. So here we go. Hands off our Constitution. Hands off our parks and trees. We the people, we say hands off. We the people, we say hands off our rights and liberties. Our rights and liberties. Okay, together, let's try it. Hands off our Constitution, hands off our parks and trees. We the people, we say hands off our rights and liberties. Okay, now I'm gonna do the verse and I'll say a line and you can repeat. We envision brighter days when all the people get fair pay, a home, our health. This is our wealth. This is our wealth. The day we care for young and old, embracing neighbors round the world, let pain and hunger cease, let pain and hunger cease, commit our hearts to peace. Now the chorus. Hands off our Constitution, hands off our parks and trees. We the people, we say hands off our rights and liberties. Again, hands off our Constitution, hands off our parks and trees. We the people, we say hands off our rights and liberties. Last line. We the people, we say hands off our rights and liberties.
Good evening, everybody. My name is Peter Gann. I'm the board member of Physicians for National Health Program. Basically, I've been fighting the status quo on what's wrong with our healthcare system since I entered medical school in 1971. I'd like to think things have changed a lot, but unfortunately I can't. I'm going to say just a couple things about why I've been involved in this for so long. Really, I've seen the suffering caused by our healthcare system as a patient, as we all have, as a provider. Also as a public health researcher, which is how I've spent most of my career. Picture this is my grandson, he's almost 2, and he's my youngest grandchild. And I do it because I want him to grow up in a world where healthcare is a right for everybody. Okay, kind of the next slide. Excellent. Okay, so I'm going to say a little bit about basic stuff about Medicaid, first of all, and then I'm going to tell you about a campaign that we hope will reclaim it. So first of all, the Medicaid eligibility limits are set by and large according to the federal poverty level. Federal poverty level for this year is shown here. I know it's really hard to see. But okay, is that better? Yeah, okay. So it's $16,000 for individuals, and it is $27,320 for families of 3, for example. Okay. What this shows is that for parents of children in Illinois, the threshold rate is 138% or 38% above that federal poverty level, okay? And Illinois is just like the US median in that regard, okay? That's for parents and also for childless adults. Now, prior to the Affordable Care Act, childless adults were not at all eligible for Medicaid. So this is the major, when people talk about how important the ACA was, there are a lot of disappointing allowed working poor and people who are unemployed to be eligible for health care with support from both the federal government and the state. Illinois is unusually generous with respect to eligibility for children. Now, as I'll go into, states have the freedom to make changes to the way that Medicaid is managed as a state program, even though the majority of the funding comes from the federal government. So you can see here that it's considerably higher in Illinois. Women, it's a little bit more than twice the federal poverty level that makes you eligible. And then over here on the right, you see these are seniors older than age 65 and people with disabilities, and they're also Illinois more generous. than the median US. So that's the picture of who is that are enrolled. And could I have the next slide, please? This just shows you the percentage. This bar on the left shows you that 49% of people who are enrolled in Illinois are adults, that is under age 65, not children. Another 35% are children, percent are seniors, and those folks are doubly enrolled in both Medicaid and Medicare. Likewise, individuals with disabilities are 6% of our population in Illinois. Over on the right, you see that, as you would expect, the younger adults and the children are healthier, so they account for a smaller percentage of the overall expenditure, and seniors and individuals with disabilities somewhat more. Okay, the next one. I know this is terribly hard to see, but I think you can probably get a sense of what's going on here. This is the percentage of the population by county in Illinois that's enrolled in Medicaid. And on the far left, the darker it is, the more higher the percentage. And you can see that's Cook County, that's dark blue up there. And you can also see some very, very low wealth counties down at the tip near East St. Louis. They're the other ones that are comparable to Cook County in terms of this. Overall, 6% of the 26% of the population is enrolled in Medicaid. If you look at children, there's something really striking. In Cook County, 53% of children have Medicaid and CHIP. So that's 53% on both combined. It's phenomenal. So that I'm trying to impress upon everybody here, if you're not already aware, how incredibly important Medicaid is. For adults under age 65, that's this year, you can see the variation across the state. You can see that there are lots of these sort of center Illinois counties where the percentages are pretty low, but in a lot of these other places they're not. And there it's about 18%. So 18%, that's still a huge population. And then among seniors, it's also 18% in Cook County. So yeah, it covers a lot of people in Illinois. Next slide, please. So why is Medicaid so important to all of us? Well, it pays nationally for 4 of every 10 births, and 4 of every 10 children in the United States is covered by Medicaid. It covers 70% of long-term care services and home care services, much more than Medicare. And when you're Medicare eligible, the long-term care and home care benefits that you get are very minimal. It's a very short number of days that you're allowed, and then you're out. And that's when Medicaid kicks in. Medicaid expansion, we know it proved that Medicaid saves lives, it improves care for people. We have seen dozens and dozens of studies showing that it reduces the mortality from heart disease, cancer, liver disease, improved outcomes for people with diabetes. And something that you don't think about, but the expansion, which brought in this young adult population and also raised the threshold for eligibility as part of the expansion, improved the mental health of caregivers for people with disabilities. You just think about those of us who've had to care for family members or friends who've had disabilities know how much of a burden that can be personally. And last of all, Medicaid spending consumes 21% of the state budget. Okay, and that amounts to billion. There's a quote from a report that PNHP put out called "Removing the Middleman from Medicaid." And I like this quote very much because it sums up why Medicaid's important. And it says Medicaid stabilizes healthcare for entire communities. Okay, can I have the next one, please? So what happens when Medicaid fails? Well, one of the things that happens is that we get a lot more unnecessary emergency room visits. We get a lot more unnecessary hospitalizations. And this stresses care for everybody. So when workers in hospitals and clinics are stressed, oftentimes with things that really should have been prevented, or they should have been taken care of if people had medical homes where they could get decent primary care. Rural and safety net hospitals are closing. Okay, and they're closing in large part because they are much more dependent on Medicaid revenue than many other hospitals. Debt collections and bankruptcies will increase. Can I have the next slide, please? So I want to say just a few things about what's going to happen January 1st coming up. The big ugly bill is going to it's going to start cutting $1 trillion for Medicaid over 10 years. The Congressional Budget Office estimates that up to 10.5 million people in the U.S. will lose coverage, including 330,000 in Illinois. And states like Illinois, which have fairly progressive government, are really going to struggle to make up the difference. So the mechanisms, how does it work? Well, it works by increasing work requirements, and people are now going to have to prove inability to work 8 hours per month, more frequent reporting to maintain coverage, removal of ways for states to raise money through taxes, and reductions in federal subsidies for expansion enrollees. So less federal money coming. Could I have the next slide, please? So this is how it works. And I want to emphasize that what I'm talking about are the for-profit managed care organizations in Illinois. County Care, which is, they have a table downstairs, that is a nonprofit managed care organization, okay? And they're down there to help you figure out some things, but I'm talking about the insurance companies. So what happens is that we pay our taxes, we pay them to the US Treasury and the Illinois Treasury, which then passes it on to the relevant federal or state agency, which then the state actually negotiates a per capitated payment per person with, these are 5 private insurance companies, and I understand that a 6th one, Humana, is going to be added in 2027. So that is a fixed amount per person. This is called putting the risk on the insurance companies, right? And so what do? They then have the power to pay providers whatever they feel like paying. It could be they use prior authorization, they use denials, restricted networks, and the less they pay for, the higher their profits. So basically, they are simply draining funds away from our public dollars and using it for these things: dividends for shareholders, executive compensation, and marketing. And lobbyists, let's not forget that. Thank you, David. Can I have the next slide, please? So we're gonna try to break that link that I just showed you. So PNHP and the People's Lobby and other groups are working on a bill to deprivatize Medicaid in Illinois. We need your help. This, as Kate said, this is going to take a lot of work and a lot of public support. We will return it to the way it worked before corporate greed went out in 2011, so that the state manages payment on a fee-for-service basis. Okay, not capitated, but fee-for-service. And we'll improve the system that provides the care. Could I have the next slide, please? Okay, so what will happen if we can actually cut out the, well, first of all, we will save money. Connecticut has already done this in 2012. They actually did this. And they estimated, it is estimated that the annual savings, if Illinois were to do it, will range between 963 million and 1.6 billion. Yeah, that's what it be. Not a T, unfortunately. We have now to think about T's. We will improve care with primary care coordination, and think about this, when we're spending only 2 to 3 cents per dollar on administrative costs instead of 14 cents, we get some extra money to think about how to make care better, and that's going to make the system even more efficient while it also provides better primary care for people. So Connecticut found already that health improved when they made this change. More doctors will accept Medicaid. They saw that in Connecticut, 33% more physicians signed up to take Medicaid patients in the first year after Connecticut passed this. So we'll use some of the savings to do primary care coordination, especially for patients, people with extra needs. This means navigators. It means something that I think is incredibly great, community health workers who can actually go out in the community, they can do health education. And it's also going to rescue rural and safety net hospitals that are at risk of closing. And I think I have one more slide. So our organization, and I know People's Lobby, feel that the ultimate goal really is universal health care through a single payer Medicare for all system. And there are a lot of reasons for that. It's for another day. But we wonder, like, what does this have to do with that? Well, it has a lot to do with it, because this is, if we get this done, this will strike a very significant blow against the entire concept of privatizing a public good in healthcare. And the second point is, we do not have to wait for Congress to do this. This can be done within the state because of the flexibility that the Medicaid program allows for states to manage their own program. And lastly, once Medicare for All is passed, Medicaid will be folded into the national system. We essentially won't need it anymore because everybody will have the same coverage through expanded, improved Medicare. Thanks very much.
Wasn't that great information? Cheers to Dr. Dan. So I'm just going to quickly introduce myself. My name is Allie Light. I am an instructional professor at the University of Chicago, and I'm a member leader with the People's Lobby, and I am chair of our campaign to deprivatize Medicaid that we're working on currently. And you're all now part of it. Amazing. Well, I just want to connect this back to some of what we heard earlier, because we were talking about authoritarianism earlier, and you might be like, where did Medicaid come from in this? I want to emphasize the fact that corporations were one of those pillars of authoritarianism. When we push on corporations, when we make them less powerful, and when we demand that they serve us rather than their billionaire leaders and shareholders, we are pushing against that pillar of authoritarianism. We also know that MCOs are an example of corporations twisting legislature to take more of our money and help to impose authoritarianism and keep us financially insecure, keep us in that loop of not being able to do anything, right? When I keep talking about the importance of Medicaid, I keep talking about how it's supposed to be a safety net. Right? So you all know, if you are worried about losing your job, one of the things you think about is, where's my health care going to come from? What if you didn't have to worry about that? What if you were in a position where you could say, hey, there's a net to catch me? But I got to tell you, as I've been using this metaphor, every time I use it, I'm like, why are you on a tightrope? Why is every day of life on a tightrope? I want to change that along the way. I want a system in which we are not feeling so financially precarious. So we are using this campaign to deprivatize Medicaid to take power back from corporations and improve conditions for us. We're going to continue to hit at that corporate pillar to win universal health care for all. And I want to thank you all so much for that. We're going to have another song real quick. Hi. My name is Pastor L. I use pronouns like she or they, and I'm a friend of the People's Lobby. And I'm here to tell my story of my personal experiences, me and my family, with 3 different healthcare systems. So my spouse, Adam, was in the military for 7 years. He was economically drafted into the Army in order to pay for college. And there's not a lot that I miss about that time. Being caught up in the war machine, having no control over where we lived, knowing Adam could be taken from me and our children at any time. But there is one thing that I miss: the healthcare system. I know what it's like to have socialized universal medicine because that's what I had for the first 6 years of my adult life. Everything was so easy and made so much sense. If I needed to go to the doctor, I went to the doctor. If I needed labs, I walked down the hall for the blood draw and then walked back to the clinic for the results. If I needed medicine, I walked down another hall in the same building to a pharmacy. And my copay on all of that was $0. My ability to afford care never factored into my healthcare decisions. This was especially salient when Adam and I traveled to Sierra Leone to spend time with our kids in the midst of an adoption process. Adam took all the medications, all the precautions while we were there, but about a week after we returned, he got really sick. I had lived in Sierra Leone off and on for years at this point, so I knew right away it was malaria. Malaria is a bloodborne parasite that spreads through mosquito bites, killing hundreds of thousands of people globally each year. The type of malaria common in Sierra Leone has a 1 to 2 week incubation period. So he didn't show any symptoms until after we were home. We lived in California in a town about 45 minutes away from Post. And so I took him to the community hospital, less than 10 minutes away, where I insisted over and over that it was malaria. But this small hospital was not equipped to diagnose or treat tropical disease, especially not one that had been eradicated in the United States 60 years prior. We later found out that the strain of malaria that Adam had was falciparum malaria, the deadliest type. In Sierra Leone, it wasn't uncommon for kids who were infected to be dead by nightfall. Well, I argued with the doctors and worked for a transfer to a more equipped hospital. Adam got sicker and sicker. His oxygen saturation fell into the high 60s as his lungs filled with fluid. His platelet count got dangerously low. He was in danger of bleeding out. His kidneys started failing. The man that I loved was disappearing in front of me, and every time I walked into the hospital room, it felt like there was less of him. I called his family and told them they needed to fly in and get there, fearing that they would have to say goodbye. And soon he was in a coma. He was 24 years old at the time, and we had been married just over 1 year. I called Adam's commander and I said, if you don't do something, he's going to die. Adam's commander called the general of the post. Those who are in the military know that's a big deal. He called the general of the post, who ordered Adam to be life-flighted to Balboa Naval Hospital in San Diego, California, where they had a tropical disease unit. And so a half dozen military men in fatigues burst into the hospital, and I fell into the commander's arms, sobbing and thanking him. A hospital landed nearby to take him to San Diego, and I passed out. They couldn't put me in the oxygen they needed in the helicopter, so my mom drove me to meet him in the hospital. When we arrived and we talked to the doctor, he told us that Adam had been stabilized, but was in critical condition. And if it had been even a few hours later, he wouldn't have made it. The doctors explained that his lungs were continuing to get worse, that they would have to use a lot of pressure on the ventilator to get him oxygen, so much that they risked bursting his lungs, but it was the only option. He said we'd know more once we saw how he responded to treatment. Adam was on a coma and on life support for 2 weeks. For 2 weeks, machines breathed for him while I sat beside his bed, wondered if I'd ever hear his voice again. I made sure he was never alone. I read the Bible to him, and I sang to him, and I talked to him. Every day, I put on makeup and his favorite dresses just in case he woke up. And thank God he did wake up. He was still on a lot of drugs at first, but even though he was totally out of it, when I would kiss his forehead, he would pucker his lips around the tube of the ventilator to try to kiss me back. After that, he spent a few days in med-surg before going home right before his birthday. He had lost a lot of weight, even with the feeding tube, and so I was feeding him like so much mac and cheese and ice cream cake to help him put weight back on. And he was out of work for a few months after that, and I cared for him until he was stronger. Adam barely remembers any of this. The medication he was on basically wiped out his memory, so he mostly gets to think back on this time as the time he got to eat a lot of mac and cheese and watch TV and not go to work. He hardly remembers being sick at all, but I remember sitting outside the hospital room or by his bedside and listening to the ventilator breathe for him. I remember watching the monitors and trying to learn what all the numbers meant. I remember memorizing the faces of doctors and nurses because they seemed to hold his future in their hands. It was the scariest time in my life, facing down losing the love of my life and the possibility of being a widow at such a young age. But in the midst of all the worries and questions, would he ever wake up? Would he have long-lasting health complications? Would he resent me taking him to Sierra Leone? In the midst of all of that uncertainty, one thing I never had to worry about was, how are we going to pay for this? A couple months later, I received a letter in the mail. It was a list of services that Adam had received. It was a long list: hospitalization, intubation, the ventilator, feeding tube, medication, tests, the life flight helicopter. Total at the bottom was like $1 million. And then right underneath the total, I'll never forget what it said. It said, "You owe $0. Any other person on any other kind of health insurance, a situation like this would completely bankrupt them." And it does. But for us, not only did we not have to worry about healthcare costs, the military gave me free lodging on the hospital grounds and a daily stipend for food so that I could take care of him. At the time, I knew that this was amazing, but it became even more real to me once Adam left the military and we went to grad school. My daughters and I were no longer on military insurance and had to rely on the marketplace to pay for private insurance. So on paper, on our tax returns and stuff, at first, it showed like that we made a decent amount of money. But in reality, all of that had gone away. We were paying an arm and a leg for basic healthcare, premiums, co-pays, everything. And for the first time in my life, I found myself wondering whether we could even afford to go to the doctor. I remember so clearly the day we got the letter in the mail saying we qualified for Medicaid. I shouted with joy to share the news with Adam. I even made up a little song and dance in the dining room about being poor enough to be poor, finally. Finally, we were able to receive the care that we needed. Now, Adam and I are pastors, and we have what we're told is good health insurance. But even this good health insurance cost me several $100s last month to biopsy my skin to make sure the skin cancer I was diagnosed with and treated for last fall hadn't returned. Even this good health insurance meant that some of my specialized physical therapy for my chronic illness has copays of anywhere between $300 and $1,000 a session. Even this good health insurance includes an $800 copay on my required annual or twice annual MRIs, and that's the price I pay once I have already met my deductible. I have a PhD, and Adam has a master's degree. We are exactly the kind of people that this system promises will be fine, and I regularly make decisions about healthcare based on what we can afford. I stopped attending my specialized physical therapy last year, not because my symptoms disappeared, but because there was no way I could afford the copay. And that means there are times when my chronic illness keeps me up at night, or pain distracts me from work, or I have to say no to doing things that I love because my body holds me back from fully living. But with the cost of healthcare, I have to choose between the therapy sessions that my kids need and my own physical therapy. And of course, I chose therapy for my kids. But the thing is, I shouldn't have to make that choice, and neither should you. After living under these three very different healthcare systems, I know that this choice wasn't inevitable. It wasn't the result of actual scarcity, and it wasn't because we don't know how to care for people. It was the result of political decisions about who deserves care and who gets left to fend for themselves. I have seen a healthcare system built for war treat my family better than a healthcare system built for profit. And the longer I sit with that reality, the harder it is to ignore what it reveals. If a system designed to support war can figure out how to get a desperately sick 24-year-old the care he needs without asking whether or not he can afford it, then why can't the wealthiest nation in the history of the world do the same for everyone? The answer, I think, is that there's already a war being fought, not just wars between nations, but this class war. Every day, insurance companies and corporate interests extract wealth from people's pain. Every day, families are forced to make impossible choices between healthcare and rent, healthcare and groceries, healthcare and childcare. Every day, people delay treatment, ration medication, ignore symptoms, and hope nothing gets worse because they cannot afford for it to get worse. And that kind of fear has consequences. As Kate was telling us, and as Allie reinforced, people who are struggling to survive have less time to dream and organize, and fewer resources to challenge the systems of authoritarianism that are harming them. A healthcare system built around corporate profit doesn't just make people sick, it keeps people exhausted and isolated and afraid. But I've lived under three different healthcare systems, and what this story has taught me is that this suffering is not inevitable. It is a political choice, which means it can be changed by political action. Yeah. We already know how to provide healthcare without fear. We already know how to provide healthcare without bankrupting families. We already know how to put care before profit. The question isn't whether universal healthcare is possible. The question is whether we are willing to fight for it. Because healthcare should not depend on whether you're rich enough or poor enough, employed enough or sick enough or lucky enough. Healthcare is a public good. And until every person in Illinois can get the care they need without fear of financial ruin, we have a fight in front of us. And it's a fight that we can win.
I will rise with all my daughters. I will rise against my foes. I will rise with all the mothers. I will carry all their woes. I will rise to fight for freedom. I will rise though faced with fears. I will rise against all hatred while my eyes are veiled in tears. I will rise for religious freedom, for a rich diversity. I will rise for all the weary, for each lonely refugee. I will work for all our women who deserve equal pay. I will work for all our children who await a better day. Sisters, oh, stand with me. Rise up hand in hand. Oh, stand with me. We will rise to spread love across this little land.
I will rise for love and justice, that we may see a better day. I will rise in peace and service, for our world in disarray. I will rise with all my brothers, for all those who cannot stand. I will rise with all our natives who have lost a home and land. I will rise to build bridges for this broken world we see. I will tear down walls between us that divide you and me. Brothers, oh, stand with me. Rise up hand in hand. Oh, stand with me. We will rise to spread love across this bitter land. Oh, stand with me. Rise up hand in hand. Oh, stand with me. We will rise to spread love across this bitter land. I will rise.
Guys, Ariane Abela, Justice Choir.
I want to thank Reverend Dr. L. Dowd for sharing their story. But we know they are not alone. All of us have stories about the challenges and indignities we face when just trying to get care. At this time, we will participate in storytelling and creation together. You are invited to consider some questions and share your experiences in small groups facilitated by leaders who will identify themselves. Small group leaders, can you please raise your hands? Thank you. Specifically for those who are more comfortable speaking in Spanish, Chella will be your group leader. Say hi, Chella.
Hello. De nada.
We have two questions for you for your discussion. You can see them up on the screen here. As you discuss, you are also invited to co-create an art piece. Write down on a sticky note, on the sticky notes provided, the answers you feel most connected to, and add them to the wall in the back of the space. With our stories, we are making the shape of a flame to be the signal fire that guides us toward the world we deserve. Now we will go ahead and break out into your groups. Again, if the leaders could raise their hands again. Gather your folks.
Oh, good question. The legislators, this is a good question. The legislators, but you pay. And I think okay, cool. So in like 15 minutes, the legislators will do some
No censoring rooms, even though they are building more asking.
Yeah. Let's give it a halfway.
Hi, everyone. If you could be moving on to the second question, make sure you're leaving yourself some time for the second question. Thanks. Just make sure you're moving on to the second question about now, just for our time.
Hi, folks. You start wrapping up your conversations and remember to write down something that stuck with you from this conversation, something that stuck with you, either something that made you fired up and upset about what we have, or hopeful about that vision of the future. If you could write that down on your Post-it and add it to our signal fire in the back. You're all such wonderful listeners for your groups. I know you're all wanting to pay attention to other people in your group and hear their stories. And again, this is the best part. But we need to move on to the next piece. So I need you to put your Post-its with your stories on the back, and then we are all going to come back together. All right, I invite you all to come back to your seats. So I know we all heard a lot of stories now. I'm sure we heard a lot of frustrations. I'm sure we heard a lot of pain. So I want to see some hands here from what you've all experienced. Raise your hand, throw your hand up. Oh, we're going to pause? Are we going to have a grand entrance? No. So throw your hands up. Who here has spent hours on the phone with insurance companies? Yes, right? Why do we do that? Okay, who has had your insurance company deny coverage for something your doctor said you needed? Mm-hmm. Who has had to change doctors because suddenly the person you've been seeing wasn't in network, or in my Medicaid people covered by your MCO? Mm-hmm. Who has been forced to talk to an AI chatbot about healthcare instead of a person? Someone from my group was saying they keep abusing saying representative on the phone over and over again. I got a trick for you, by the way, for insurance companies from my husband, who's an expert on this. The first time you get a helpful person on the phone, ask them to stay with you on the phone through transfers. That's my pro tip. Who feels like this system should just be easier? Like it should just be easier for us to get to the healthcare that we need. Yeah, I know we all do. Yeah. So how are we going to get there? One of the ways that we are going to get there, one of the ways that we organize to get there with the People's Lobby is by working with elected officials who understand where we are coming from and are fighting to make this system better. And so with that, I want to introduce to two of our incredible legislators here. I'm going to start with our state senator, Graciela Guzman. She is the state senator for this district that you are in right now, and she is my state senator. So pass this to her.
Oh my God. Hello. All right, when I say people, you say power. People, people, people. Oh, it's so good to be in a church on a Friday with you all, man. I'm Graciela, I'm your state senator. I also happen to live just down the street. Sorry, allergies, it's a thing. Reflecting on I think two things I was asked to speak about, which is healthcare and organizing. So I'm gonna take you back to the year of 1988, which is the year that my parents immigrated from El Salvador to LA. And then they met, it was super cute, and then I was born. And then my siblings, there's 5 of us in total, we all got to grow up on Medicaid, Medi-Cal in the state of California. I could tell you all about that, but fast forward, much of our childhood was spent looking at who in our own family and who in our community had access to healthcare and who didn't. And for our family, it was strictly on the sole basis of who had immigration status and who didn't. And for a lot of folks in our community and in my own family, that sole decision of like who got to be born where dictated who got to live and who got to die in my family. And so there's generations of people that should be here that died really, really painful deaths. And I say that because for the longest in my childhood, I didn't have a vocabulary for it. I just knew that it was really horrible. I knew that I really wanted my grandfather. I knew that I really wanted my grandmother. I knew that I really wanted my aunties, but like didn't really have anything for it besides the fury that you feel, right? So fast forward, I'm now in college. I'm getting to sit in an anthropology class for the first time, and they're teaching me what medical racism is, what disparities are, what policy is, how it interweaves. And so when I get to Chicago, where organizing is not just like how we do things, it is like how the city moves. And my experience with what I had grown up with and this like failure to have a vocabulary, but to have like a really real physical reaction to this is meeting a space where folks are saying, based on your zip code, you also get to maybe live or die in a very different way in Chicago, right? If you live in Englewood, if you live in Albany Park, if you live in Lincoln Park, if you live in Rogers Park, like all of those areas each have their own age disparity range. So for me, how I got to come of age here in Chicago was the signing up of thousands of people into the Affordable Care Act, right? It was getting to kind of be like the Paul Revere of healthcare for a little bit, if I could go there and be like, I promise healthcare's coming. I think Medicaid's coming for you. It's gonna be awesome. And then it kind of wasn't awesome. It was awesome to be able to look at some of our patients that desperately needed transportation, that desperately needed medical equipment, who I'm like already doing horrible. But I promise I will tie this up in 30 seconds or so, which is to say that in the thousands of patients that I helped sign up, I saw the beauty of the promise of healthcare, but also the failure of the delivery, right? Which is to say that our stories are really, really powerful, and how we connect with folks that right now across our state have really, really different experiences that all need to be heard. That all do have a place in policy, because our policy can be robust and strong enough to catch all these people, but also that the organizing game has to be profound, because healthcare is deeply personal, right? Who is here? How do I get to live? Who do you see me for? What am I good for? I've had patients tell me that. All of that is bound to our healthcare system that right now doesn't make people feel like they're a lot, but it should be the opposite. So I say that because the organizing and what we're doing here and figuring out what we want to talk about, how we want to talk about it, how we want to connect with each other, how do we create these really open braced spaces to unpack healthcare, also create this momentum for what are we going to reimagine and re-envision in Springfield and in places like it, where I sometimes talk about it as a place where imagination goes to die. Because we love it, but it likes to tell us no next year. or no, maybe this way. So the organizing has to exceed that place. And so I just want to ground us in why what you're doing is so important, because healthcare is a human right. Healthcare is a human right. Healthcare is a human right. And if we're going to get there in a way that is inclusive of all of you here, of many people that wish they could be here but cannot be here, our organizing has to be like A++. So if you feel like you got something out of talking to your neighbor or out of the pod work that you think is going to elevate your organizing game, can you say, what up? What up? If your organizing game is going to level up, because we have to level up to the place where millions of Illinoisans have coverage that don't have it today, can you say what? That is what we're building through people power. Thank you.
Wow. All right, I want to invite up our next legislator. We have Representative Lindsay LaPointe, one of our amazing allies of the People's Lobby, with whom we passed HB 1085 last year. Thank you, Allie. Thank you, the People's Lobby. And yes, we did pass HB 1085, which gets behavioral health professionals reimbursed more by commercial insurance so they can continue to take insurance so people can get access to mental health care. Thank you. All right, so I myself am a social worker turned state representative, and I used to do homeless street outreach up in Old Irving Park, Portage Park, and I did that work in 2012 before we expanded Medicaid. So, doctor, when you were talking about how the fact that childless adults, quote unquote, now have access to Medicaid and what a big deal that is, I was sitting there thinking about the homeless street outreach I used to do with childless adults and how they had zero access to Medicaid in 2012, which meant zero access to addiction treatment and mental health treatment that could be covered by insurance. And so even though we have an immense amount of work ahead of us and we have to protect Medicaid for quote unquote childless adults, we have made progress. And I want to touch on real quick the progress that we have made and have yet to make at the state level, because it's so easy to think about Congress and Medicare for all on a national level, but there are things that we can and should and are doing at the state level. So I'm going to touch on a few of those things. At the state level, we can control what we do related to about 40% of everyone in Illinois on commercial insurance. It's called state regulated commercial insurance. So when we make changes for commercial insurance, it's about 40% of all people that are on some type of commercial insurance. We also have so much leverage when it comes to Medicaid at the state level, because that's a joint federal state program. We make decisions about what the reimbursement rates are. We make decisions about what Medicaid covers. And this year, we just passed a package, and one of the things it does is make sure that Medicaid will cover telehealth for intensive outpatient treatment, because that wasn't covered before. And I almost forgot about that really important win. So 2 other things. Something we did at the state level and something that is a behind the scenes implementation thing that's really important when it comes to Medicaid healthcare. So a bill that we passed 3 years ago, if my math is correct, yes, seeks to expand access to behavioral health care, which means mental health, addiction, trauma treatment, harm reduction. And it can be difficult to do that if we don't have professionals in those roles that are getting compensated adequately. And we also need professionals who reflect the population of Illinois, not just the typical mental health professional, a white woman. Because guess what? The world is beyond white women. So we passed a bill in Illinois that created an alternative to the licensed clinical social worker exam. And we did that because data showed that the exam was racially and age biased. And since we passed that bill, there has been almost 1,000 people who now are fully licensed clinical social workers that can bill insurance and provide healthcare to people. Healthcare to people. That's a big deal. 1,000 new social workers. And the one other thing I'll say as I'm over time, this is a behind the scenes thing, and this is why we need scrappy legislators. This is all about Medicaid managed care. I got a call 4 days ago
from a mental health organization. Some of you might know Chicago Therapy Collective. They are our biggest mental health provider, providing targeted mental health to our LGBTQ community. And they had just been denied a contract with Meridian. And Meridian, as you saw on the slide, is one of our today 5 Medicaid managed care organizations. So they needed help with somebody stepping in to call Meridian directly and say, why? Why did you do this? And I looked up the numbers, and that state Senate district where Chicago Therapy Collective is located, which anecdotally I think is probably the highest concentration of our LGBTQ community in the state, Andersonville, Boys Town, 7,000 something people are on Meridian. So it's not acceptable for Meridian to just say, nope, not doing it. So that's where we come in, and we step in and advocate to Meridian, their lobbyists, to HFS to say that is not acceptable for you to just deny this contract. So we're going to continue to do that work, and everything you're doing to organize out front and behind the scenes is leading to more access to care. We have a huge fight ahead with pushing back on the harms coming from Washington and the loss of Medicaid, but we are here to fight that fight with you.
Thank you so much, Representative LaPointe and Senator Graciela Guzman, who is my senator, and really happy to hear what she had to say tonight. So hello, everybody. Is it getting cooler, or am I just hallucinating? Okay, wasn't sure. You're all hanging in there. You look great. So my name is Nikki Nash. I use she, they pronouns. I am a volunteer leader in the healthcare task force of the People's Lobby. Yeah. And I identify as, among other things, a Texan. But after 46 years of living in Texas, I moved to Chicago in the winter of 2024. Texas and I need a break. And I am so happy to live here, and I'm happy to have found the People's Lobby in which to make my political home. Yeah. When I moved here to Illinois, I wanted to change how I engage with politics. With the People's Lobby, I have met both my state senator and my state representative, and several other senators and representatives to discuss and promote legislation that is important to me. I've helped plan 2 trips to Springfield during the spring session so that I, along with over 100 other volunteer members, could make our voices heard at the Capitol. I've gone to tremendously useful trainings, educational events like this, and even some parties where I've met so many fantastic people. And I am proud to be in this community of thoughtful, caring, determined humans, such as you have heard from tonight, and there's many more. So I want to talk to you about something we do to hold ourselves accountable to accomplishing goals like dignified universal health care for all, is by committing to ourselves and to each other to take action. We use a simple form, or what we call a commitment card. Our lives are busy and complicated. I know mine is, and everyone else I know. But we use this tool to declare what we want to prioritize for ourselves and our community to the best of our ability. This is how you take what you've heard and seen tonight and what you felt this evening, and you turn it into action. So I am personally inviting you to participate in the commitment card. You can scan the QR code. There should be a sheet where you're sitting. If you would like a paper copy, please raise your hand and someone will bring you one. And I'm going to talk you through what is on that commitment card real quick. So if you do the honors here. Okay. It's coming on. Well, people can grab those QR codes. You're not sure how to do that, I bet your neighbor does. Okay, and I'll just tell you real quick what's going on with these commitment cards. So first up, you'll see on there that we're holding an event called How Our State Can Lead the Resistance, an Illinois Budget Debrief Town Hall. Woo! If tonight's discussion has you wondering about how to pay for the healthcare we need or any other social service that requires funding, this event will be a good fit for you. And here is my, and maybe yours, Representative Will Gazzardi with a few more words about it.
Thank you. Good evening, everybody. Good evening, everybody. Yeah, all right. Welcome to the 39th Legislative District. I know you guys, when you crossed the border, you felt like a certain kind of good vibe. You didn't know why. You entered the 39th House District. That's what happened. I'll be really brief about this event. So raise your hand if you're on Medicaid in this room. Medicaid. Any Medicaid patients in this room? Anybody know a person who's on Medicaid? Anybody know if people on Medicaid have ever had a hard time finding a provider? Yeah, right? The reason is the state doesn't pay them. The state doesn't pay doctors to cover Medicaid patients. Our reimbursement rates are too low, and so doctors say, I just want to see private pay patients. I don't want to see Medicaid patients. And that's wrong. So the reason I tell you this is because the struggle for healthcare is intimately bound up with the state budget. Where does our money come from and where does it go? And how are we going to tax the rich and the biggest corporations in the state to fund Medicaid, to fund healthcare, to fund social services for everyone? So if that question seems interesting to you, where the hell does our $56 billion budget come from? And why aren't we spending more on Medicaid to help people get covered? If that seems like an interesting question you want to learn more about, come join us Saturday the 20th at Schurz High School, right on Milwaukee and Edison, just a short drive from here or a short trip on the CTA. It's going to be a great event. We're going to talk about what happened in this spring's legislative session, get into the details of how the budget works and how we can fight for a better and more fair budget. Thank you, guys.
Thank you so much for that. I will definitely be there, and I hope to see some of you there as well. Just want to give a shout out to the rep too for riding his bike here. That was really cool. So the next event listed on the card is political education, Medicaid, power, and universal health care. So this is a session you can attend to learn more about our healthcare system and what it will take to change this. If you're like me and still get Medicaid and Medicare confused, come to this session, and there's no shame there. We will be here at St. Luke's. It'll be in July. We don't have the date and time, but if you click that box, we will make sure you hear the details when they're ready. Oh, that's a great point. Thank you, Mary Margaret. Yes. Third, you will see the People's Lobby monthly healthcare task force meeting on Tuesday, July 7th, 6:30 to 8 p.m. This is a Zoom link. There's people from all over Chicagoland and beyond that join us, and you are all welcome to join us. I'm sorry, the electeds can't come, but everyone else can come. I'm sorry, you can have your own party. We talk about a lot of things. We do a lot of planning, and we would love to hear your voice in that. If you check that box to register, you will receive the Zoom link. And then fourth on this section, I want to invite you to contribute financially. This is the weird part where I ask people for money, but I will do it because of how much I believe in what we're doing here at the People's Lobby. We have over a dozen amazing staff. Shout out to any staff here tonight. Woo-hoo. We drive people to Springfield, and we always bring lunch. We get to have good food at events like this. We engage in the work of tearing down the pillars of authoritarianism and cause actual financial damage to corporations that get in our fucking way of the world that we deserve. So, things like that. We want to be independent. We are and will continue to be independent from the ultra wealthy and the political parties. The more our funding comes from the people, the more we can use that money to build the world we all deserve. There's a place for everyone in the movement. For some people, it's giving time, and that's great. For others, contributing money, even if it's just a little bit, is what they have space for. So I want to invite you to consider joining our shared work in that way today. Yes. Say again. Cut the rest. let people do the rest. Okay. Yes. So sorry. Hannah's the boss here. I don't think we've heard from Hannah much tonight, and I just want to say thank you, Hannah, and great job. So check out the rest of the card. You can tell us if you want to get in touch. You can give us feedback. That's how we grow. Please do fill out the card, even if it's just a tiny piece of it, because we want to stay in touch and continue this conversation. Please submit it when you're ready, and then those of you who have paper copies, we'll grab them from you soon. And we are going to wrap it up, and I will turn it back to our fabulous MC, Cherie, to wind it up for us. Thank you very much.
Okay, we have come to basically the end of our program. First, thank you for being here, for caring about your neighbor enough to organize and figure out how do we get the healthcare that we need. I want to remind folks that after this is over, we still have downstairs, we have resources, art, food, and community. If you want to continue the conversation, you can go to the large classroom to share your story with someone who is there and ready to listen. Also, feel free to catch one of the organizers in the back to schedule a one-on-one. So to invite folks to leave, and we invite folks to leave, there will be some more singing. We invite folks to join in or leave while it is going on. Again, thank you for being here. Thank you for caring about your neighbor. And I hope that when you leave here, that you feel more powerful than when you came.
You gotta put one foot in front of the other and lead with love. Put one foot in front of the other and lead with love. You gotta put one foot in front of the other and lead with love. Put one foot in front of the other and lead with love. You gotta put one foot in front of the other and lead with love. Put one foot in front of the other. Don't give up hope. You're not alone. Don't you give up. Keep moving on.
Lift up your eyes. Don't you despair. Look up ahead. The path is there. I know you're scared, and I'm scared too, but here I am, right next to you.
And lead with love. Put one foot in front of the other and lead with love. Lead with love and lead with love. One more time. Lead with love. Thanks, everyone.